And with that, I'd like to introduce our next speaker, Dr. Clint Bahler. Dr. Bahler is an associate professor of urology at Indiana University in Indianapolis. He also serves as the principal investigator of the Fusion Global Registry, which contributes to the growing body of real-world evidence in focal therapy. Tonight, he'll be sharing his real-world experience with the Lux model and how advancements in workflow, procedural efficiency, and dual therapy of BPH and prostate cancer are influencing his daily practice. Dr. Bahler?
Hey, great to join you. Great to be a part of this and get to share in the fun of the webinar, sharing on HIFU. Transforming clinical practice, real-world experience, Lux for prostate cancer and BPH. So next. Jumping into it, I do, have the big disclosure that it was invented at IU, so a shameless plug for the history at IU. We're very, very proud of that. Next slide. And then just looking at IU, how the cases have grown, and looking at our first quarter, I think we're on track for about 80 this year. So it'll be our biggest year yet. So I think there's increasing enthusiasm, and also just among us as urologists, knowing how to use the HIFU and who are the best candidates and all the rest. Next. So a little bit about our experience at IU. Starting in 2016, we started with hemiablation or focal HIFU, and we've done about 250 of those cases, and most are for primary. And it's about an hour and a half room time now for most of the patients, and about 40 minutes is actual on ablation time. And no pain meds. Patients are off for about a week now, and catheter 3 to 7 days, and like the results presented before, very low rates of erectile dysfunction and incontinence. Next. These are from Shoji's report, so and of course he's going to present as well. But this was very captivating, thinking of the physics of it and how it could decrease flow in the prostate, allow us to focus energy. Next. And just a few more slides where he had an MRI contrasted a couple weeks afterwards, showing decrease in the enhanced area anteriorly. And actually, when we looked at our first few post-HIFU failures that we did prostatectomy on, when we did whole mounts, the cancer failure areas looked quite a bit like the A panel here, where it was anterior, in the anterior area where it looked like the HIFU had failed. Next. So in preparation, I went ahead and last week wanted to show a little video of the bolus guide, which thankfully SonaBlate has printed for us and now comes in our kits. Stopping at the end, you can see that it just allows the directional bolus so that when you add fluid, it all goes anteriorly. Next slide. Also, since this past Wednesday we were doing HIFUs, I went ahead and wanted to show compression during case. So we just recorded over the prostate as we did this. And go ahead and I think it'll start if you hit next, and then, oh, there we go. Thank you. So it starts at about 3.5 centimeters tall, and as we add compression, it's kind of fun to see the prostate get pushed against the pubic bone. One more next, we should be able to can see it get pushed, and then so it went from 3.5 centimeters down to 2.5 centimeters. So dramatic compression. So now I want to present a case, and this is using the original software, so you can compare a little bit with this. I have one other case where we're using the Lux software, but a 62-year-old, PSA of 7.2, and 3+3 prostate cancer. So 31 gram prostate, so fairly high PSA density. Then he got a repeat biopsy with us at IU and upgraded to 3+4. And a low risk decipher. Next. So just showing that MRI, you can see it's a right anterior lesion. And this was back before we had bolus guides, but we knew of Dr. Shoji's work and had started doing compression. Next. Now this is the old software. So showing zone 1, we'll go ahead to zone 2 next. And then finally zone 3 next. So we had added about 100 mils of fluid to this system to compress the prostate without the bolus guide. Just 33 minutes of ablation time, and the tissue change monitoring system, which just gives an indication of the tissue being affected by the heat, was good. Next. But I really love the MRIs. So current practice, we get an MRI 1 year after HIFU. And you can see in this case, the whole right side of the prostate is gone. It's just collapsed in. And this is pretty typical with compression. Whereas I think without compression, there may have been times we struggled to get heat to the anterior. But with compression, we're pretty routinely seeing this where, the urethra is basically on the patient's right, for right-sided HIFU, and just the left side of the prostate is remaining. Next. Kind of makes it hard to biopsy. How do you do infield biopsy? There's not much that you can even sample after the HIFU for your post-HIFU biopsy. So HIFU with compression, this was a right hemi ablation. His prostate went from 30 down to 19 grams, and the PSA from 7.2 to 2.3. And the MRI was negative for lesions. So he's not had a post-HIFU biopsy up to this point. Next. Okay, now with a bolus guide, it's maybe just 40 to 60 mils, and you achieve a lot of compression. So it's a little easier to do it. And, we notice prevention of swelling, improved heat transfer. It does compress the prostate, so you have a smaller volume to treat during the HIFU. And many times we're able to go from 3 treatment zones down to 2 treatment zones. And I think there's less near field heat buildup with the compression, so less treatment pausing. Next slide. I think the new Lux software definitely saves time. We have a slide in showing that, the bolus guide, and then we'll check out a case of checkerboard for BPH. Next slide. Okay, so we have a 72-year-old, and the PSA is 4.5. It's a 70-gram prostate, and can you do HIFU for a 70-gram prostate? And of course, it depends where your lesion is and where you're targeting and whether you can reach it. So you can see here, he has a right-sided peripheral zone lesion that's maybe mid to apex, but about a 9 millimeter lesion. And we see on the template biopsy sketch 3+4, and his AUA symptom score is 26. So next slide. So this is kind of showing how we set up the checkerboard here. You could do the treatment sequentially. So far, I guess I just want to keep myself maximally stimulated by doing them at the same time. But you do have to toggle your energies with checkerboard. So in this case, we've done a few patients where thinking about reducing the catheter time, we've done maybe a 10-minute channel TURP on the opposite side of the cancer. Always trying new things. But in this case, so we had the right-sided treatment and then the left-sided checkerboard. Next slide. And this should be playable. Yeah, so this just shows we already done zone 1. So we're starting in zone 2. And you can see the software just work its way down through the rows. Now, on the checkerboard side, we go to max power, the 45 watts. And I think it's fun to see what is sometimes called popcorn, or these white blanched areas of steam. And especially on a compressed prostate on the checkerboard part, you can kind of see it in some of these rows. There you go. All right, next. So this patient, we're seeing the 3 zones, really good treatment changes, moderate or large was the vast majority. Next slide. Okay, so right hemi ablation for cancer, checkerboard on the left. And in this patient, we saw his AOA symptom score go from 26 to 11. It's 70 gram prostate down to 25 on the 12-month MRI, and no lesions on that MRI. And his PSA went from 4.5 to 0.67. And the checkerboard is a way to, when I initially started treating BPH, I did a full treatment on both sides. And there's swelling with that. There's some added time with that. So the checkerboard is an alternative solution where you reduce the volume of the gland, potentially less swelling, and you reduce the procedure time a lot as well. But we can discuss checkerboard a bit more in the discussion afterwards. Next slide. Just our first patients that we were doing BPH treatment, a cancer treatment on one side, BPH on the other side, and significant reductions in the AOA symptom score. So next slide. Okay, so yeah, thanks for the opportunity to share. We all know that HIFU, focal, or hemi ablation has amazing quality of life, and with the Lux software and compression, we feel that we're getting better oncologic outcomes. And with BPH, we have the ability to treat 2 things at the same time, or either or. Thanks so much.